Hello, everyone. I am Rizel Vito, a senior high school faculty of Congressional Integrated High School, now taking up my doctorate degree in Industrial Education Management. On this video, I will be presenting my research study, which is very timely and relevant to the crisis we are facing today. To start with, the World Health Organization reported that as of January 10, 2021, there have been 89 million coronavirus cases around the world and about 1.9 million deaths and continually counting. This situation provided us with devastating effects we now call as the new normal. And to mitigate the possible more damages of COVID-19, it is everyone's duty to suppress its transmission and control national and local outbreaks. In the online release of Fortune magazine media, it has been cited that Taiwan holds the world's best virus record, considering that it is very proximate to the center of epidemic, China. It surpassed New Zealand, Iceland, Singapore, and Vietnam, measuring based on their death toll and public health measures employed by their governments. It was also cited to be the only major country in the world that has so far been able to eliminate community transmission within their borders. According to studies, Taiwanese citizens' sufficient knowledge, compliance, and adequate facilities all contributed to control the virus. Concludingly, the knowledge, attitude, and practice people hold played an integral role in their readiness to accept health measures from the authorities. With this, studies on KAP around the world are employed because information dissemination is highlighted to be the weapon to fight COVID-19. One of these countries is the Philippines. The study of Lau et al. On the KAP towards COVID-19 in the income-poor families in the country revealed that there is a need for health education as a response strategy to fight the disease, and it must be contextually relevant to specific groups or place. It also suggested that frequent practice in preventive measures is associated with great knowledge about the disease, meaning contextually understanding KAP can help authorities in tailoring better health response and communication strategies. Another study on KAP was conducted among selected employees in the NCR as more workers go back to work with the lifting of strict quarantine measures. The respondents showed high level of knowledge and strong positive attitude towards health education and the seriousness of COVID-19. A highlight of this study is the positive attitude of the respondents on stricter government measures and their less favorable attitude towards the government's response against the disease. On the other hand, the education sector in the Philippines pursued the reopening of public schools last October 2020, making the risk of infection for school personnel to be a critical issue. Congressional Integrated High School is a public school in Dasmariñas that have been conducting modular distance learning since the reopening of school last October 2020. This required their teachers, students, parents, school administrators, and non-teaching staff to participate in the physical retrieval and distribution of learning materials. Such activity made them vulnerable to the disease. Therefore, it is vital that COVID-19 infection prevention and control, or IPC, be measured through their KAP or CAP. Locally understanding their CAP is a must to inform the school administrators in the need for possible trainings and policies during the outbreak and a guide in prioritizing protection and avoidance of occupational exposure. On this regards, I conducted the research entitled Knowledge, Attitude, and Practices Towards COVID-19 Infection Prevention and Control among school personnel of Congressional Integrated High School. This will be the first report on the knowledge, attitude, and practices of the participants with scope covering school personnel. The main objective of this study is to measure the level of their KAP of COVID-19 among school personnel in Congressional Integrated High School. Specifically, the researchers sought to determine the following. First, the demographic profile of the respondents in terms of age, sex, school personnel category, monthly family income, and highest educational attainment. Second, the level of knowledge, attitude, and practices towards COVID-19 IPC of the respondents. Third, the significant difference in the level of KAP of COVID-19 of the respondents when grouped according to their demographic profile. And fourth, the significant relationship between the level of knowledge, attitude, and practices of the respondents towards COVID-19 IPC. Shown in Figure 1 is the relationship of the variables in the study. The independent variable is the respondent's level of knowledge, attitude towards COVID-19 IPC, while the dependent variable is their level of practice. So the respondent's demographic profile, such as age, sex, school personnel category, and monthly family income, serve as, serves as the moderating variable of the study. The research adopted a descriptive quantitative-based cross-sectional study design. An online questionnaire was also created using Google Forms, and the link was shared in DepEd school email and Facebook accounts as it is primarily used by the respondents. This survey was conducted after almost a month of public school reopening during the pandemic, from October 29 to November 7, 2020. The actual enrollees of the school were yet to be calculated that time due to online enrollment, which application must be further followed up and verified. A combination of non-probability sampling, such as snowball, and purposive sampling was utilized. The researchers shared the survey form to the school admin, non-teaching, and teaching staff who were able to ask to deliver the link to their co-faculty, students, and the latter's parents or guardian who participated on the recent module distribution. The dataset included 219 responses that were collected and was used for further analysis. The survey instrument utilized in the study was adapted from the questionnaire developed by Safi et al. 2020 for Indonesian undergraduate students. The basis of the questionnaire was from the previous studies of COVID-19 and MERS-SARS and from WHO's official website. So it has undergone revalidation and showed acceptable reliability and validity. The instrument included four major groups of variables. A. Demographic profile. B. 18 items measured their COVID-related knowledge. Each question of the knowledge section was rated with 1 was given to correct responses and 0 for incorrect. C. 6 items measured their COVID-19 related attitude using a 5-point Likert scale with 1 for strongly disagree and 5 for strongly agree. And then 12 items measured their COVID-19 related practice. Again, 5-point Likert scale was utilized from 1, which means never, and 5, which means always. The respondents' demographics, COVID-19 related CAP, were analyzed using frequencies and percentages. The CAP-based responses were summed to create an index for each that were used as continuous variables for analysis. As these continuous variables were not normally distributed, as derived from the Shapiro-Wilk test of normality, the Kruskal-Wallis non-parametric test was employed to determine the demographic profile associated with COVID-19 KAP. This identified whether the categories within each demographic variable significantly differed on each outcome. Spearman's rank order correlation analysis was utilized to understand the relationship in between knowledge, attitude, and practices. So, all statistical analyses were conducted using Microsoft Excel 365 and SPSS 26. So, the following are the salient results of the study. As presented in Table 1, majority of the participants belong to ages ranging from 25 to 54 years old, female, and students. Students are the largest portion of the population of CIHS personnel. Data also depicts majority of the school personnel are in the lower middle bracket and even lower. Additionally, 114 out of 219 who participated did not finish high school. This is corresponding to the findings that 52% of the respondents are students of CIHS. Table 2 introduces the frequency and percentage of correct and incorrect answers from the given 18-item knowledge test. So this points out that the respondents are more knowledgeable in the cause and prevention of COVID-19 through crowd avoidance. But some are confused with its transmission from dead bodies. Majority of the school personnel has high COVID-19 related knowledge, particularly on its etiology, symptoms, and prevention, but has misunderstanding on its risk groups and transmission. Shown in Table 3 is the summary of knowledge scores of the respondents, with 76% obtaining a high score. Of the 18-item multiple choice test, about 23% obtained average, while only 1% are in the low range. Displayed in Table 4 is the CIHS school's personnel attitude responses towards COVID-19 IPC, which strongly agree, implying strong positive attitude, and strongly disagree, implying strong negative attitude. Among attitudinal questions, 59% highly agree that it is important for the community to get updated with information regarding COVID-19 preventive efforts. In contrast, almost half of them negatively perceive that all COVID-19 cases are from the violators of government's COVID-19 preventive measures, and more even responded neutral. Concludingly, the respondents' attitude towards reception of information, social interaction, and self-motivation are positively inclined, yet disagree that violation of preventive efforts from the government are mainly the cause of one's infection. Presented in Table 5 are the preventive and control measures towards COVID-19 infection and the CIHS school personnel level of practice for each. It is then revealed that all the items are always practiced by majority of the school personnel. High positive response is indicated by 86% of the respondents always wore face masks, and 79% always use hand sanitizer in the last few weeks. Among all the items, there are 9% of CIHS school personnel who never took vitamins or supplements to increase their immune system, while 7% never rapidly practice exercising. All in all, it may be said that majority of the respondents frequently practice compliance and prevention efforts, but some of them has seldomly exercised a clean and a healthy lifestyle. As shown in Table 6, data reveal that there is statistically significant difference between the knowledge level of the male and female sex group, with mean rank knowledge level of female higher than male. Similarly, the highest educational attainment of the respondents has proven to have significant difference with the doctorate level having the highest mean rank and the high school graduates having the lowest mean rank. This result affirms the study of Lau et al. In 2020 in the income poor households in the Philippines. that higher levels of education were associated with greater knowledge of COVID-19 transmission routes. Data in Table 7 indicates that there is significant difference in the attitude of CIHS school personnel when a group according to their age, sex, and school personnel category. It is revealed that attitude level is statistically significant between age brackets. Prime working age, or those who are in 25 to 54 years old, who represents the majority, gathered the highest mean rank attitude score, while the mature working age, or 55 to 64 years, acquired the lowest mean rank. It is also evident that sex groups have significant difference in the level of attitude. The mean rank of female is higher than male. Likewise, there is also a statistically significant difference among school personnel category of CIHS. The non-teaching staff acquired the highest mean rank, and the students got the lowest attitudinal score. Referring to Table 8, it is depicted that there is a significant difference in the level of practice towards COVID-19 among respondents when grouped according to their age, school personnel category, and highest educational attainment. So prime working age again, those who are 25 to 54 years, again attained the highest mean rank in the level of practice, while the early working age, or those with 15 to 24 years, have the lowest mean rank practice score. So in the same way, it was also proven that significant difference exists in the school personnel category in terms of their practice, with the non-teaching staff attaining the highest mean rank. The lowest mean rank was then gathered by the students. Additionally, there is also a significant difference between the practice level when respondents are grouped according to their highest educational attainment. The highest mean rank in practice score was remarkably gained by those who did not finish elementary, while the lowest mean rank was from the high school graduates. As proven by Table 9, there was a weak positive correlation between knowledge and attitude to practice towards COVID-19, IPC. This implies that when an individual is with high level of knowledge and positive attitude towards COVID-19, they are more likely to always practice its implementation. From the results of the study, the following conclusions were drawn. So although KRPIR are high, improvements can be executed, especially in understanding COVID-19 risk groups and transmission, attitude towards government health protocol violations, and always practicing clean and healthy lifestyle. It is depicted that females have higher knowledge and more positive attitude than the male respondents. Prime working ages, or those who belong to 15 to 24 years old, are also perceived to be with higher level of positive attitude and practice than any other age bracket. Furthermore, the non-teaching staff of CIHS has also the highest positive attitude and practice, while the students had the lowest attitude level and practice among all school personnel. Those who had higher level of educational attainment are also proven to have higher knowledge towards COVID-19 IPC, but those with the lowest education, such as unable to finish elementary, gain the highest level or highest frequency of practice. Overall, the study revealed that the higher the knowledge and attitude, the greater the practice of prevention measures toward COVID-19. Hence, it is recommended that, number one, continual knowledge broadcasting in COVID-19 IPC with added focus on risk groups, transmission, effects of health protocol violations, and practicing clean and healthy lifestyle to remain an upright practice and even make it better, particularly for the students. Further studies on focusing on COVID-19 IPC could also be conducted on a larger scope. And lastly, constant enforcement of infection prevention and control measures in COVID-19 be observed and executed in order to further lessen community transmission among school personnel. Together, let us cooperate and fight against COVID-19. Thank you for listening. For questions, you may contact me through the following.